This is an overview of IAFM in the shoulder region. The specific areas that you're going to treat will depend on the specific injury that you're dealing with and the location of the injury and where the adhesions are found. Generally speaking, the anatomy you want to avoid in the shoulder region will be the bony landmarks and the neurovascular landmarks. Bony landmarks include the clavicle, acromion, and the spine of the scapula, and the medial border of the scapula. And the neurovascular structures include basically everything in the axilla or the armpit. Also, the cephalic vein here is superficial, but you usually don't have to worry about it. As far as technique goes, normally we want to stroke distal to proximal because the superficial veins carry blood to the heart, right? But in the posterior shoulder, the superficial veins actually carry blood from proximal to distal or from medial to lateral. There aren't that many vascular structures in the posterior shoulder anyway, so you probably don't have to worry about the direction of the stroke. You usually want to focus on 3 to 4 inches at a time. We don't want to be doing like these really long strokes. And as far as treatment frequency, if you're dealing with a chronic or a recent injury, you're going to want to perform the technique 3 to 4 times a week or every other day. If you're performing IAFM for maintenance or prevention, it'll be more towards 1 to 2 times a week. About 80% of shoulder problems involve the rotator cuff. Right, so it's the posterior muscles, infraspinatus, supraspinatus, and they attach to the lateral aspect of the humerus, or the greater tubercle. The edge that I'm going to be using on the shoulder today is going to be SEX, S-E-X, or small convex. In the original, it's this one right here. In the lips, it's right here. And in the ergo, right here. Some people refer to this edge as the tongue depressor. So before we start, remember to apply emollient. Our emollient is made specifically for IAFM. It's solid at room temperature and melts upon contact, and it's made with natural ingredients. It's also made to fit our handy dandy case here. Nice little space for it right here. By the way, all the anatomy that I talked about is found in our anatomy guide, which goes through all the anatomy to avoid and all the anatomy to focus on. And it also has some post-treatment exercises. So let's get started. So here I'm going to be working on supraspinatus using SEX. I'm going to do about 20 strokes. The protocol usually asks for about 10 to 30 strokes, so I'm going to do 20 here at about 180 strokes per minute.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 18, 19, 20.
Just about like that. Starts to get a little red. It's about the limit right there. And if it's for prevention, again, 1 to 2 times a week will be enough. Another good edge to use on the shoulder is MEX or MEX, medium convex.
6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20.
There we go. And we're also going to get these teres muscles here. The teres are also commonly affected with shoulder issues, so I'm going to apply some emollient. And here we go.
12, 13, 14, 15, 16, 17, 18, 19, 20.
It's good. Now if the adhesions or the issue is found on the anterior shoulder, you're going to want to focus more on delts right here, or pecs, right? Pec minor, pec major. Pec minor's deep, but that's pretty much the gist of it. We keep it simple here at Myofascial Releaser.
You can find our tools on Amazon and or myofascialreleaser.com.